Now see the megaloblastic anemia. Megaloblastic anemia. Megalo, the name itself indicates here also, means large, mega. Megaloblastic, mega cells. Which cells are mega? Which cells are large in size? That is the RBCs. Because anemia, it is overall, we will see the RBCs, okay, deficiency or any type of, it is related with the RBCs, okay. So here megaloblastic anemia is a form of anemia. In this, RBCs found immature and abnormally big in size, and some are nucleated. Actually, how the RBCs are? How the RBCs are? These are the disc-shaped without nucleus and normally in normal size. But here, how? The size is large. So the name indicates megaloblastic anemia. And here also the lifespan of the WBC is decreased. How much the lifespan of the RBC is? Normally 120 days. But due to that immature one, the RBCs are die within 40 to 50 days. Okay. And these are here the HB content. The hemoglobin content of each RBCs is normal or increased. Normal or increased about the hemoglobin content. But the cells are fragile, breakable, easily breakable because these are immature and having the large size, so that the lifespan of the RBCs are here reduced to 40 to 50 days. Okay. In addition to iron, the body needs folate and number of vitamin B12 to produce the sufficient numbers of healthy RBCs. So requirement for the preparation for the production of the RBCs, which are those one? Iron we need for production of the RBCs. Also along with that we need folate and vitamin B12. Folate and vitamin B12. So if there is any deficiency in that, one of these three, then also it causes the immature, abnormally big in size RBCs. Okay. Now, what are the cause? The most common cause of the megaloblastic anemia is the deficiency of vitamin B12 or folate or folic acid. Okay. Cyanocobalamin. Wait, spelling wrong. Cobalamin only written here. Cyanocobalamin. Okay. Cyanocobalamin. That is the vitamin B12. That is the vitamin B12. Cyanocobalamin. Okay. That is the vitamin B12. Okay. So, and folate, that is the vitamin B9. Vitamin B9. These two vitamins serve as a, means helps as a building blocks and are essential for the production of the healthy cells, such as precursor, means starting material for the preparation of the RBCs, red blood cells. So what is the cause? The main two, that is the vitamin B12 or vitamin B9, that is the folate. One of these, if it is having any type of the deficiency, then definitely it causes the megaloblastic anemia. Anemia is also caused by low production and easy lysis of the RBCs. Low production, the production is less and and early lysis of the RBCs. Early lysis breaking of the RBCs. Due to what? Due to immature or large size of abnormal large size, there will be breaking or fragilation of the RBCs. So lifespan here, how much? 40 to 50 days. 40 to 50 days. Okay. So we can here, what is the main cause? deficiency of either vitamin B12 or vitamin B9, that is the folate, and the low production of the RBCs and early lysis of the early breaking of the RBCs. Early lysis, that is the breaking of the RBCs. Okay, understood this one? Now symptoms as it is, that is the same like that of the other. That is the shortness of the breath, muscle weakness, the skin will become pale, loss of appetite, loss of weight, diarrhea, dysentery, nausea, vomiting, fast heartbeat, glossitis or swollen tongue, glossitis, inflammation of the tongue or swollen tongue, a smooth and tender tongue also here, tingling in the hands and feet, okay, numbness in the hands and feet, sensation losses. Okay, these are all about the signs and symptoms. And how the diagnosis, we can diagnose this type of the patient by physical examination, by CBC, checking the complete blood count. If you will appear, if the RBCs in that blood, if they appear underdeveloped or large size, then the doctor can understand that the individual is suffering from megaloblastic anemia. And one more test, that is the Schilling test. You should keep in your mind this test, that is the Schilling test. Here what we will evaluate, here we will evaluate, diagnose the evaluation of the ability to absorb the vitamin B12 from the body. How much the absorption of the vitamin B12 take place. If though we are taking from the diet vitamin B12 sufficiently, but if our body is not having the capacity to absorb these type of the vitamin, so there is a deficiency of vitamin B12. So by this test, we can understand the ability to absorb the vitamin B12. Now, treatment according to that causes, the treatment is there. What is the causes main behind that one? Both the vitamins are deficiency, that is the B12 and B9, folate, and so give that supplement via orally or otherwise injectable, or by through your diet, that is the animal or dairy products like the milk, eggs, fish, meat, okay, all the dairy products and the leafy vegetables for the to improve the folate deficiency, that is the folic acid. So sometime you understood that one, you if you will if you this one, if you will check thoroughly in your means home, some are the fellows individuals in your family member, if they are suffering from the anemia, the doctors will give both type of the injections, that is including vitamin B12 and folic acid. The doctor will mix and they give the injections to increase the hemoglobin and RBCs. Okay, this is all about the treatment of the megaloblastic anemia. Understood? Very simple. All these anemias are according to the name only we can understand that. No need to by heart these type of the anemias. Okay, so we will stop here only.